Got it.
So hopefully you can hear me online, but I'm Sherry Allen. I'm the manager for Providence Intervention Center for Assault and Abuse, also known as PICA. And a little bit about me, I'm a nurse. I've worked for Providence Hospital for 23 years this year. I went to the Intervention Center about 7 years ago as a program nurse, and then I became a manager about 3 years ago. So it's an amazing program, and I'm very proud. So please let me know if you have any questions, anything to add, or want to know anything else. I did bring some pins and magnets and some brochures, so I'll pass it around and help yourself.
Yes, right.
Yeah. Okay, so next slide.
Okay.
So just a little overview of the Providence Intervention Center, or PICA. We were started in 1979 by Sister Georgette Bayless as an advocacy hotline. And she saw a need to support the community and support survivors of sexual assault. In 2011, we moved to Dawson Place, where my office is currently. And it's a child advocacy center, and they're one of our core partners. So the partners for Dawson Place is the Intervention Center, Compass Health. They see clients under the age of 22 for therapy services. They also have Snohomish County Prosecutor's Special Investigation Unit, Snohomish County Sheriff's Office, also Special Investigations, and Dawson Place has child forensic interviewers. So we are housed at Dawson Place, but we're a partner. We don't get any funding or support through Dawson. We just work together to support clients. Oops, can we go back?
Oh, yeah, sorry. My finger twitched.
So we, as PICA, provide medical, advocacy, and therapy services to any client for physical or sexual assault. So we see domestic violence, physical abuse, child neglect, elder abuse, anything someone would go to the emergency department for acts of violence.
So they all go to Dawson Place?
No, we support emergency departments with our forensic nurses and advocates, so we go to the emergency department.
Oh, okay. Oh, okay. So you're the ones that travel to them.
Yes.
In that situation.
Mm-hmm. Okay. We have about 38 staff. So at Dawson Place, I have 2 nurse practitioners, 2 medical assistants. I have a total of 18 forensic nurses that travel between the emergency departments and Dawson. I have 2 therapists, 1 manager, 5 volunteer advocates. So we do take volunteers to go respond to the emergency department as part of our grant funding, which is really nice. And 12 advocates that respond with our nurses. We'll talk a little bit about what advocates do. And then I have 1 administrative assistant that keeps me out of trouble and making sure everything gets turned in on time. Next slide. So who we support is anyone impacted by violence, physical, emotional, or sexual violence. Anybody who's been sexually assaulted, we see all ages. So we see children, adolescents, adults, and elders, children who've been abused, neglected, or endangered, and again, domestic violence. We also see trafficking individuals. So the I-5 corridor, Everett, up to Canada and down to California, is a big trafficking network. So trafficking means people, we used to call it prostitution. Now it's trafficking, someone using someone for sexual acts that result in money being exchanged. We see elders, and then we also support families and partners of people that have been assaulted or abused. And that means with therapy, support services, whatever they may need, not just the person that has been abused. Next slide. So our medical services include our nurses, our healthcare professionals who've been trained to treat survivors that have been affected by violence or trauma from sexual assault, intimate partner violence, or any intentional harm. We provide medical exams. which include lab testing and follow-up, photography, medication to prevent infection and pregnancy, evidence collection, and injury follow-up in our clinic. So once they've gone to the emergency department, they can come to Dawson Place and see our nurse practitioners. They don't have to retell their story. They don't have to tell why they're there. We can retest for lab work. If they've had injury or bruises that need to recheck, we can do it there. Next slide. And then advocacy services. Our advocates listen to the survivor. So I always call them the heart of our program. They provide the emotional support, empower them to make decisions. They let them know what their rights are, and let the survivor know what decisions are best for them, or help them decide what decisions are best for them. They help answer questions they may have, provide information on our community services, talk through self-care strategies, help create safety plans. We also have a legal advocate that can help with protection orders. They are not legal people, they're not lawyers, but they can help guide them in the direction that they need to go. They'll also respond to court with a client. So when they have to testify or go before a judge, they have somebody with them. They provide support during the medical exams, help reporting to law enforcement. So often crimes may happen months ago, and then the survivor feels strong enough to tell somebody or report to law enforcement, and our advocates are there for them. And then we also have a 24/7 helpline. So we publish it throughout the community. They can always call and talk to an advocate any time of the day. Next slide. PICA also offers counseling, which is very unique to a lot of programs. Our counselors are trauma-informed therapists, and we see adult survivors. So Compass Health sees children, and we see adult survivors of sexual assault. We also see their family members, so we provide that support to secondary victims. They can talk about self-care, coping skills, helping set boundaries, building healthy relationships, and letting people know that everybody's unique and they've all gone through trauma in a unique way, but there's nothing normal or abnormal. Everybody's individual. So, okay, next slide. So locations, I mentioned a little bit about the emergency departments. Our forensic nurses and advocates respond to 5 emergency departments in Snohomish County. So we go to Providence Hospital on Colby, Cascade Valley, Arlington, Swedish Mill Creek, Swedish Edmonds, and then we'll be adding the new location, Overlakes, freestanding ED. They just opened in October. So we'll be able to go there. And anytime a client checks in to the ED for sexual assault or physical abuse, the staff is always trained to ask them if they want a forensic nurse or a. All of our services are totally to support the client. We don't work for law enforcement. We don't work for CPS. We're there to make sure they're healthy, they're taken care of, and they're emotionally supported.
Do you mind explaining the acronyms and what acutely referred means?
Yes. So at Dawson Place is where our clinics, our nurse practitioners are, and we can see clients that are referred from their primary care provider. LE is law enforcement, or DCYF is Department of Children, Youth and Families, or CPS. And acutely referred means it can happen, say they went to their primary care doctor and disclosed that they are being assaulted by someone in their family. They can send them directly to Dawson Place. They don't have to go to the emergency department. And then we do a lot of follow-up at Dawson Place. Again, for that trauma-informed care, the client doesn't have to retell their story. We already have all their information. And we can follow them. We do labs initially in the ED. We do them again at 6 weeks, 3 months, and 6 months after to make sure they didn't have anything before the assault, and then we'll follow them for the next 6 months to make sure they didn't get anything from the person that assaulted them.
Next.
Yep, next. Our program also does a lot of community outreach. We try to let people know that we're here. It's probably not a program most of you have heard about before. So we do events like National Night Out, which is in August. Each community usually has some type of street fair, and we go and we have little trinkets like I brought today, toys for the kids, and so on. We did Everett Pride in June. We also did Stanwood Pride. Dawson Place always has a resource fair geared towards children, and that's in April. This year, I was able to go to that one, and it's a lot of fun. They had a band, they had performers, they gave away pizza. I don't know how many pizza boxes they had, but it was a ton, and it was really well received within the community. And it's right at Dawson Place next to the library in Everett, and they block off the whole street. A lot of fun.
Wow.
And we also attended Aquasocks, the Healthier Community Days. It's sponsored by Providence, but we had a table there. That's in July. And then we went to Sounds of Africa Fest, which is in August. It was also, I believe, in Everett. It might have been Linwood, but we try to do a lot of outreach for diversity and to make sure we're reaching the entire community and people that may need us. And that's a picture of myself and one of my medical assistants at National Night Out in Arlington.
Cool.
It must have been during the summer because it's still.
Yeah, it was nice.
Still light.
Yeah, exactly. We had some sunshine. We also provide a lot of community education. So my nurses and nurse practitioners and my advocates, we do a quarterly education for Everett Police Department. We talk about strangulation, the effects of domestic violence, the reason why clients should go to the emergency room or come and see us in the clinic. We talk to domestic violence services of Snohomish County to let them know if they have a client that discloses to them where they can go. We also have MOUs or memorandum of understanding with the Naval Station in Everett and in Oak Harbor, so that they can come send their active duty members to us if they're not able to take care of them on base. And then we do some advocate training with Naval Station Everett. We also provide education for emergency department staff so that they know when to call us, and to make sure that our name is out there. If a client reports for physical abuse or child abuse or whatever they may check in for, to give us a call. We just did yesterday a presentation at Lake Stevens Library on Safe Touch. It was geared towards parents, but kids are welcome to come too. Teenagers, they have a really nice brochure about internet safety and safe touch and just everything that community members might want to talk about. We always provide a trauma-informed approach to all of our services, and I touched on that before. It's always up to the client what they want done. Trauma-informed philosophy, our core principles are safety. We want to make sure the client's safe in the emergency room, safe when they go home, that they have trust and transparency. We always tell them what we can do and what we can't do. We don't have housing resources. We can refer them to community resources, but we don't have anything as part of our program. And then we also are mandated reporters, so we make sure the clients know that if they're under 18 and it's a sexual assault, it is reported to law enforcement. We always tell them they don't have to cooperate. They can cooperate as much as they want to. We're there to make sure they're safe and healthy.
Who are mandated reporters? What jobs? Like
Our mandated reporters?
Yeah.
Medical personnel, teachers, law enforcement, that's to call CPS, just anybody that's in a responsible or public figure that is, has people reporting to them, I guess. We also allow peer support. So when they're in the emergency department, they can have a family member or friend with them. We want them to feel safe. collaboration. So when we're doing an exam, we want to make sure that we're doing the exam they want. We typically do a head to toe, document any injury, but if they're like, I only want you to look at my leg, then that's all we look at. We would only document what they want done because we're there for them. Empowerment and choice, that also, when somebody's been assaulted or abused, a lot of their power has been taken away. So we want to restore that so that they feel like they have choices, that they can do what's best for them in the moment. If they consent to an exam and 10 minutes later they're like, I'm too tired, or I'm too scared, they can always do it later. We'll stop whenever they're ready. And then we always try to be culturally appropriate and take into effect historical gender issues. So that's why we do a lot of training around culture and diversity and making sure that we're respectful to the person and what's going on with them at the time. Okay. This is our contact information. It's on our brochure. It's on our little cards that I brought. Our offices are on California Street in Everett. We have that appointment line, our advocacy line, which is Monday through Friday, and then the 24-hour helpline, which is 24 hours, 7 days a week, and somebody will answer. This is our staff. This is from the Dawson Place Luncheon. They put on a luncheon fundraiser for Dawson Place, and we always get to go. So it's my medical assistant, our nurse practitioner, myself, one of our program nurses, our administrative assistant, one of our forensic nurses, one of our advocates, and another advocate. On the bottom row is our other nurse practitioner, an advocate, our medical assistant, one of our therapists, and then one of our forensic nurses. So that's part of our team. We have about, like I said, about 38 people. So.
You more, yeah.
Yes, exactly. All right, what questions do you guys have?
So I live in King County, not Snohomish. Is there a comparable organization and service in King County?
King County is a little different. They have forensic nurses that are a part of Harborview. So if you report to any hospital emergency room for an exam, their forensic nurses will see you. And then they have a separate advocacy program. And I think it's called KSART, King County Resource Center. And they are an advocacy team. So our program's unique because it provides both advocacy and forensic exams, and we work together where they're totally separate departments.
You said there's a 24/7 hotline, but how did they find it? How would they know?
It's on our website. If you Google sexual assault, it will come up with Providence Intervention Center. We're part of RAIN, which is the National Resource for Sexual Assault. Will have us listed for sexual assault. So our advocacy helpline is on all of our business cards, all of our brochures, and on our webpage.
Do you go to the schools, especially high schools, to give the information?
We have tried. It's very difficult because of legislature and funding around sexual assault and education. So we do a lot of the community outreach so that people have information, National Night Out, and all the other resources. But in Arlington, on their student cards, ASB cards, I forget what they're called now.
Yeah, that used to be what it was.
Yeah, exactly. Yeah. They used to have RAIN listed, which is the national hotline for sexual assault. Now they have our helpline number on the back of their card, so they can call us locally, which is a big step. So we're trying to get that on everybody.
I have a question about how are you guys funded? I see that you have 38 staff, which is a huge staff. But you mentioned grants. Is it all grants?
So prior 2 years ago, we were more than 50% grant funded. And then with the new administration, we lost a lot of grant funding. And even with Washington State budget, we lost some grant funding. So now Providence helps pay most of our salaries. And we have about a little over $1 million in grant funding. And we have about
That's
$2 million.
just sitting and waiting for it to be used, you mean? Okay.
Yeah, which I apply for every year, so it is competitive. It's a competitive grant. I have our grant funding helps pay for our advocacy, our therapist, and then a little bit of our nursing program. We never bill the clients for services. We can bill state of Washington crime victims. Victims of crime can fill out an application. It's like a LNI form and get their medical care paid for. We can bill insurance, but we never send a bill directly to clients for sexual assault or physical abuse.
So whatever the insurance company pays, that's just all that you get and you don't. Okay,
Yeah.
cool.
So are your grant sources still governmental?
Yes, I don't have any.
No private grants?
No, this year we were very fortunate. Providence has a Festival of Trees fundraiser that supports children's programs, and we were the Department of Need. So they were able to raise over $600,000 for our program, which will get us through this next year. But to be totally transparent, our program has been under scrutiny because we don't make money and we don't, we have a big budget because we have a lot of staff. So it is something that we're hoping will continue, but we're not positive.
So does the county provide any funding?
No, but if you have any resources or recommendations, I'd be glad to apply for them.
Because this came under public health
Yeah.
department, and the county would be providing something.
Oh, okay. Is it like through Snohomish County?
Yeah, maybe if you could contact the Snohomish County Health Department, because it's now a department of the county. It's not an independent anymore.
Oh, okay.
So maybe if you contact them, they can do something, but you know, this is something I'm advocating. I think every city in the county or every city in the county that you touch should be contributing to the program.
That would be nice. A lot of programs in California and different places charge the police departments to do exams, which feels wrong in my heart.
Yeah.
But because we don't work for the police department, and I don't know that they can say that, but we're there to support just the client, and that makes us very unique. But somebody else asked me about county funding, so I really need to look into it. Providence Foundation is they're actively looking for private donors or people to help support our program, and getting our name out there as much as we can really helps.
So if the funding doesn't come in, would you look for more volunteers to do the work, or what would you do?
That's a very good question. I mean, I'm lucky right now to have 5 volunteers. It's usually they're young people that are applying to medical school and they need an outreach or community service. I don't know what we would do. There's a program like ours in Olympia that is also Providence Intervention Center, and they had to close their child advocacy center, and they're only providing forensic nursing exams. And they didn't have advocates, but they had social workers and other support services, and they had to close them because of funding. So I feel very fortunate that we're here this year, and hopefully we'll continue many more. But the future is very uncertain right now.
How many people are you helping per year, and do you see that increasing or staying stagnant?
Yeah, I looked at our numbers from 2024 and we saw about 1,100 individual people. That doesn't include follow-ups and things like that. And then this year we're about 50 more from 2025. Sorry, we saw just a slight increase. So.
You know, there's a Snohomish County High School Counselors Association that at least they used to have regular meetings and figures and things. I think the word needs to get out to those people.
I think so too.
Maybe go to school board meetings and something like that.
So it's a Snohomish County Counselor meeting? Okay, I'll look that up too. I know our advocates do respond to schools, like if a child reports to one of their counselors and they don't want to come to our office, our advocates will go there and talk to the child and then provide resources or refer them on if they need a medical exam. But not all counselors know about us, so.
That's right.
Yeah, that's a really good point.
So the beautiful bundles.
Yes.
Beloved bundle.
Yeah.
The beloved, beloved beautiful bundles.
They were very-
Yeah, beloved bundles. So those were dispersed throughout your, was it 5 or 6 different?
Yeah, through
Emergency
all 5
departments?
emergency
Yeah.
departments
Uh-huh,
and
uh-huh.
our office.
Uh-huh.
So I have bundles at Dawson Place, and then each emergency department, we took a full tote and put the bundles there. And we let the emergency staff know that they're available if they have a client that doesn't need our services but needs supplies, that they're there, so.
And how long will the ones that we give you, how long will they last?
That's such a good question. I don't know, because it's such a variable.
Right.
You know, people, if they've are coming in, brought in by law enforcement or ambulance, and we're going to take their clothes, quite often they'll need new supplies. Most of the time, they're coming from home and they've changed or already provided their own new supply of clothes. So they may last the whole year, or we could have a whole influx of people and need more supplies. But it was very much appreciated, especially the little bags and the toiletry supplies, and just, you know, feeling human again is such a big, important step in healing. So,
Just let us know if it feels like you would need them in like a month or 2, and we'll start work.
okay, perfect. I'll keep a inventory. I'll have, we go to stock all the departments all the time, so we'll have everybody check in. We may have a run on sizes, so because they are.
Yeah,
so unique.
absolutely, yeah.
Yeah,
Mhm.
but
And that'd be good to know, like what sizes you need.
Yeah, exactly. Mhm.
Did we have did they gave us the array of different sizes? We
Yes,
didn't.
but it wasn't equal. They
It
obviously
wasn't,
have
yeah.
some system where they,
Yeah,
mostly
yeah.
medium
They didn't
to
get
large
choose
or
the
whatever.
sizes, yeah.
Mhm.
And did you have any for children? Like I have often a need for pediatric or toddler sizes.
Yeah, I think that we didn't
They were
choose
all
that
different.
for
That's
just for
possible.
simplicity of what we
Mhm.
were doing, but next time we could do that separately, maybe.
Yeah, we
Yeah,
can.
see if we can, I'll see if I can do that
Okay.
separately.
Yeah, because we had just the other day, somebody was looking for pediatric sizes, and it was because they had a diaper blowout and they didn't want to send them home in the dirty
Oh.
pants. So
Yeah.
it wasn't for any other reason.
Okay, that's good to know.
You never know
That's
what
good to know.
somebody needs. Yeah, I know, exactly.
And sometimes even, in some situations, even if you could take your clothes home, you wouldn't want to.
No, totally.
Yes, exactly.
I mean, there was small women was included, but
Mhm.
there weren't a lot.
Yeah, there was a good
I
variety.
mean, a small woman could handle a teenager,
Mhm.
probably.
Mhm. Yeah, we definitely,
And better to have clothes that are too big than too small.
exactly,
Yeah.
yeah. Mhm. Yeah, but we appreciate the men's sizes too. Quite often we see a lot of men, and programs aren't always geared towards them, so it is it makes me feel more supported to have those sizes.
That is, actually, that is a question. What is the percentage of men that you see?
Probably of all of our clients, maybe 2 to 3%
Mhm.
are men.
Okay.
Mostly.
Well, that's good that you do, that
Yeah.
some do report. I know probably
Exactly.
they don't
It's not
report.
that it's not happening, it's just that they don't
Yeah.
feel comfortable reporting always, so.
Mhm.
Mhm.
So if they're only 2 or 3%, you may get unbalanced in terms of your sizes. So,
Mhm.
yeah.
Mhm.
Hopefully we could, really target specific sizes if you ran out.
Mhm. Yeah,
Does
so.
Vicky have any question? I just don't know if you notice if she does, if she's honest.
Do you have your hand raised? I can't see the screen because they have me turned.
I-
Yeah, why don't you ask?
Okay, thanks for the great presentation.
Oh,
So
thank
I'm
you.
in Portland, Oregon. Do you have a similar program to Dawson Place in Portland?
Portland has, Providence has a forensic nurse team there. They don't provide advocacy though, so I don't know who's providing advocacy. But they just opened a new a freestanding clinic in Portland that is run by forensic nurses. And I would love to have our own building, but I just want to get through the year, so.
Right.
Yeah, but,
That's a completely separate program though, separately funded. It's not associated.
right, they have the Providence name and they're Providence employees, but, funding is totally different. We all have our own separate funding. Mhm.
Did you have any other questions, Vicki? Okay.
And that's, one thing that makes our program so unique is advocacy. So many programs are either just advocacy, like domestic violence services, or victim services of Snohomish County, where we have advocacy and medical. And we work very closely together, obviously, so, yeah.
It's great. This is a great program.
Thank you.
Yeah.
I'm very proud of us and so proud to be a part of it. It's been the best job I've ever had. I love our team, so yeah, very nice.
We're glad.
Continue to keep it, I believe in this, but continue to keep us looped into things that we could do to support
Okay,
the work that you do. We do some very small grants from our club, but also just having, your team involved in, spreading the word of what you do. We usually do have more people attending and
Oh,
we have,
sure.
different kinds of events or things like that. I can see there might be some good connections both ways, either us attending something new or vice
Perfect.
versa.
Yeah, we would
fit
love
for
to
what we do.
present at even one of your big national meetings or district meetings.
Yeah.
Mhm.
Whatever you feel would be appropriate, because the more people hear about us, especially community members like you,
Yeah.
spreading the word and letting people know we're here.
Yeah.
Yeah, we do have also a monthly, just with the district, a Zoom that we have and
Oh,
we'll bring
okay.
guests to that also, so. That's something that I facilitate with
Yeah.
the district, so.
Perfect. Yeah, we would love to attend. Just let us know.
Great.
Yeah.
Great.
Well, thank you so much. I
Yeah, thank
really
you.
apologize for not having more people here
Oh,
today.
that's okay.
I don't know what happened.
I don't either. That is very unusual.
It is,
But we do have a few little chargers for you.
Oh,
And
perfect.
I want her bag of stuff too.
Oh, good. Okay.
Yeah, these will come in handy. So many times people are in the emergency room and that's their one complaint. They didn't bring their phone charger or they're trying to contact domestic violence services.
I really dig in my house. I'm sure I can find about 10 more.
I did dig. I thought I had more.
Yes, thank you so much. It was a pleasure to meet you all and
You too.
Yeah,
appreciate
very-
the invite.
Yeah, thank you so much. It was a great presentation. We learned a lot.
Thank you.
Yeah.
Thank you.
Hey,
Okay.
bye you two. Well, do we want to save these
I
raffles?
want to, yeah, I think we should say,
Save them?
yeah.
Okay, because it's just the four. I mean, the odds of us winning are really, really high.
I know, but the option, my goal is to raise money for the foundation.
Absolutely. Let's wait. Yes, let's wait.
Yeah.
Okay, so then it's gonna be a short meeting. Vicky, we're gonna say so long and cut it short.